Hi, now I will be talking about hiatus hernia in this class. Now, what is this hiatus hernia? Hiatus hernia refers to presence of a part of stomach or a pouch of small pouch of stomach, a part of stomach in chest because of weakness in diaphragm. Normally, the lower esophageal sphincteric area, gastroesophageal junction, is present at about 40 centimeters from incisors when we do upper GI endoscopy. This is the normal position of lower esophageal sphincter. When this lower esophageal sphincter shifts up, that means it is above 40 centimeters. That means it is at 35, 37 or 30 centimeters. That means it has shifted upwards towards oral cavity, towards chest. So this is known as hiatus hernia. When it shifts upwards, a part of stomach will come towards the chest, and this is we call as hiatus hernia. Now, this incidence of hiatus hernia below 40 years of age is about 9%, and gradually, as the diaphragmatic muscular weakness increases, the incidence of hiatus hernia will also increase. The incidence of hiatus hernia increases because of increasing weakness of muscles. It also increases if there is increase in intra-abdominal pressure. Suppose if there is excessive accumulation of fat in the peritoneum, in that cases in obese persons, there is the incidence of hiatus hernia will increase. Similarly, if in chronic liver disease there is a massive ascites, then also pressure in the abdominal cavity increases, and this will push part of stomach up. If there is a pregnant lady, the incidence of hiatus hernia again will increase in pregnancy, and then it will go to normal after delivery. Whenever there is history of chronic constipation, again because of recurrent increase in intra-abdominal pressure, the part of stomach will go upwards, and this is known as hiatus hernia. So these are the various conditions in which hiatus hernia is produced. Sometimes hiatus hernia is also produced as a result of steering wheel injury, as a result of accident while driving a car. So in these cases also sometimes hiatus hernia develops. Now usually this hiatus hernia is classified into two types. There are two types of hiatus hernias. One is sliding variety, which is more common, and other one is paraesophageal hiatus hernia. In paraesophageal hiatus hernia, there is rolling of a part of stomach up towards the chest. There is organoaxial rotation of stomach, as a result of which stomach will go towards right side in the chest. But the lower esophageal area, which we call as sphincteric area, is maintained in its position. So in these cases, you will not get reflux. Instead, you will get pressure symptoms. Pressure because of stomach which goes up into the chest. It will produce pressure on, it will put pressure on heart, as a result of which heart activity is hampered. It will produce pressure on lungs, as a result of which pulmonary functions are compromised. So these are the features of paraesophageal hiatus hernia. Sliding hiatus hernia is more common. In these cases, because of shifting of lower esophageal area up towards the chest, the normal sphinctering functions of lower esophageal area, they are hampered, they are disturbed, as a result of which that particular area becomes lax, and the acid and food material which is present in stomach will go up towards the esophagus as soon patient lies down. So in these patients, you will get a history of heartburn, retrosternal burning sensation. This retrosternal burning sensation is because of reflux of gastric acid towards esophagus. Sometimes there is chest pain, which is very similar to angina. So again, here you will have to differentiate it from angina. You will have to differentiate it from the coronary artery disease. In the cases of sliding variety of hiatus hernia, because of chronic reflux, sometimes there is repeated regurgitation, repeated aspiration of food material in respiratory tract, because of which these patients they develop chronic respiratory illness. Sometimes these patients are misdiagnosed as a case of bronchial asthma. They may develop chronic bronchitis. Sometimes they develop recurrent pneumonia because of aspiration of food material present in stomach. Sometimes they develop chemical pneumonitis because of aspiration of gastric acid in lungs. So in a case of sliding variety of hiatus hernia, these are the features. If this hiatus hernia remains like this for a long time, and if there is severe reflux, gastroesophageal reflux disease is of severe variety, then in these cases, sometimes later on patient may develop carcinoma of esophagus. Usually adenocarcinoma is common in these cases. Sometimes because of chronic irritation, chronic inflammation, later on patient may develop strictures. There is narrowing in esophagus. So in these cases, later on patient will start complaining of dysphagia. So in this hiatus hernia, though it is very common, it can be very easily managed. Now, how to diagnose a case of hiatus hernia? Hiatus hernia it can be very easily diagnosed with the help of upper GI endoscope. When we do upper GI endoscopy, normally lower esophageal sphincter is lying at about 40 centimeters from incisor. Lower esophageal sphincteric area, rather we can say that lower esophageal sphincteric area is lying at 40 centimeters. There is a GE junction. When this GE junction shifts upward, that means hiatus hernia is present. You can easily demonstrate reflux of food material during endoscopy. So endoscopy is diagnostic. Apart from this, you can perform barium studies. If hiatus hernia is too big, then in that case you will have to perform CT scan of chest. Paraesophageal hiatus hernia you can diagnose with the help of simple X-ray chest and CT scan of chest. Now, whenever a patient comes to you with history of this symptoms of hiatus hernia, and you have diagnosed it as a case of hiatus hernia, then in these cases you can treat that patient by telling him to take meals in pieces, not to do overeating. Number 2, tell them to reduce body weight, to perform relaxation exercises. You will have to give proton pump inhibitors. You can give H2 histamine receptor blockers like ranitidine and famotidine, but proton pump inhibitors are more useful. Together with this proton pump inhibitors, you can use prokinetic agents like levosulfide, you can use domperidone or any type of prokinetic agent which should be given before meals, at least about half an hour before meals. So this is how you can treat a case of hiatus hernia and its symptoms. If it is producing too much of problem, then in that case surgery is advised, and the surgery which is done in these cases is Nielsen's fundoplication. That will treat this hiatus hernia. If it is large one, it can treat up to some extent. Paraesophageal hiatus hernia is it requires surgical treatment. You cannot manage it medically. So this is all about hiatus hernia. Thank you.